Blood clot experts want you to get a COVID-19 vaccine, and here's why. Reports of blood clots associated with select COVID-19 vaccines have likely frightened many people. However, blood clot experts advise the public to get vaccinated because the benefits still outweigh the risks. The big insight is some young, seemingly healthy patients suffered from massive strokes due to COVID-19. This means the disease has a greater chance of causing blood clots than the adverse event being connected to vaccines. Dr. Alex Spyropoulos, a professor at the Feinstein Institutes for Medical Research, said, "As a blood clot expert, I can tell you it's the most blood clotting disease we have ever seen in our lifetimes." According to CNN, Dr. Spyropoulos and colleagues conducted studies showing that treating COVID-19 patients with blood thinners lowers or even prevents blood clots. While getting a vaccine prevents both SARS-CoV-2 infection and blood clots it can cause. The Advisory Committee on Immunization Practices of the US CDC only confirmed a small number of blood clot cases in women who received the J&J vaccine. Some possible mitigations, like adding an extra warning for recipients or limiting those who should get the vaccine, are being considered. Regardless, the risk remains very low. Before the pandemic hit the world, the CDC estimates 900,000 Americans affected by blood clots a year, noting the condition as extremely common. Around 796,000 people suffer from strokes annually in the US alone, as per the American Heart Association. For blood clots being linked to COVID-19 vaccines, an underlying mechanism may be involved and is likely related to the little understood immune response. Although the connection is unclear yet, experts have called the condition vaccine-induced immune thrombotic thrombocytopenia, or VITT. It is a very rare blood clot characterized by bizarre clotting combined with a low number of platelets. In a study published in the New England Journal of Medicine, researchers studied 22 patients who developed VITT after receiving AstraZeneca's vaccine. They analyzed the blood samples of patients and found low or normal fibrinogen levels and elevated D-dimer levels at presentation. At that point, there was no evidence of an imbalance in clotting factors, which hinted at something else. Further analysis showed all 22 patients tested positive for antibodies to platelet factor, or PF4. These antibodies work against PF4 and often represent a rare reaction to the blood thinner heparin. Despite supporting an immune-related issue, the findings don't fully explain everything. Experts nevertheless recommend getting vaccinated, but they are not dumping the blood clot situation. Some suggested measuring the real size of the problem so it can be addressed properly.